Good afternoon. Welcome to the St. Clair County Emergency Management Agency daily briefing, where we're running just a few minutes behind, but the phones are busy today, and so we're here. We have Chairman Mark Kern with us, and also Sam Bierman from the Health Department. Sam, numbers just a
tad better.
As far as the daily and tested. So why don't you
happy.
tell them what we got?
Yes. So as of today, 58,477 tests have been performed on residents of St. Clair County, and that is an increase of 853 from yesterday. We are at 5,503 positive test results, which is an increase of 54 from yesterday, and that does include males and females from under the age of 10 up to their 80s. And as Director Simmons said, we are happy with our numbers today, and our county positivity rate is 6.3%. And remember, that is for St. Clair County only. We are at 52,977 negative test results. And unfortunately, we are adding an additional death today, which does bring our total to 174 for the county. That was a female in her 90s who did have underlying health conditions. And as always, we send out our sympathies to her family. For those who have completed their IDPH required 10-day isolation period, we are at 4,621. For state totals, 3,781,051 tests have been performed, with 223,470 positive test results, which is an increase of 1,680 from yesterday. And for deaths, the state is reporting 7,917, which is an increase of 29 from yesterday. For hospitalization numbers, and these are for hospitals that do reside in St. Clair County, currently we have 49 patients that are admitted due to COVID-related reasons. None of those patients are on ventilators. One question that we had been asked a few days ago was if we could get a regional number for hospitalizations, and we will be happy to provide that when we can. We may not be able to get that number every day, but we do have it today. And our regional number for admitted patients for the region is 101, and 8 of those patients are currently on ventilators. For congregate living facilities that are in outbreak status, and that includes both staff and residents, if you have 2 or more that are either COVID positive or who have COVID-like symptoms, we have 2 changes in our list today. The first is Caritas Family Solutions in Belleville, and they are at 26 cases and no deaths, and that was an increase of 3 cases. And Caseyville Nursing and Rehab, which is currently at 28 cases and 2 deaths, and that was an addition of 1 death. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So regional hospitals are the Illinois hospitals that are in our region, doesn't it? Even though people may go to Missouri
That is
for
correct.
hospitals, that really doesn't play into our regional hospitalization.
Correct. It's the same region that we get our numbers from, which is Bond, Clinton, Madison, Monroe, Randolph, of course ourselves, and Washington County.
Okay. So because, that some people will say, and then rightly so, there is a certain amount of capacity on the Missouri side of the river for
Absolutely.
us too, because a lot of people, that's where their doctors are in Missouri.
Especially if you have underlying health conditions, you may have a specialist on the other side of the river. So yes, that is a question that we do get, but our regional ones stay on the Illinois side.
And when the Illinois Department of Public Health looks at numbers, that's what they look at, the Illinois numbers.
Exactly.
Great.
Yes.
Thanks, Sam.
Absolutely.
Well, I think it's worth mentioning too that that's an important number that we have to watch. So as much as we can get that information, we want to start reporting it, because that's another metric that we get judged on is our hospitalization. And we've had some followers say, well, you've only had between 40 and 50 people here in your 4 hospitals in St. Clair County. We're thinking about this as a region. And as we talked last Friday when the doctor was with us, the hospitalization is being prepared. They're not only prepared for COVID patients, they have to be prepared for every other type of emergency. So right now, like I said, in the region, there's 101 COVID patients, and 8 of them are on ventilators.
And so your regional number includes the St. Clair County number?
Yes, it does.
Yes.
Okay.
Yes.
All right, so 52 beyond us. I can add
Yeah.
and subtract, and I can multiply. So we'll move into the zip code reports at this time, but I never can divide. I will never divide. 62059 remains at 11. 62201 goes up 3 today to 218. 62203 remains at 174. 62204 remains at 126. 62205 goes up 1 today to 176. 62206 goes above 400 today. They're at 402. They went up 6. 62207 goes up 1 to 224. 62208 goes up 3 to 338. 62220 goes up 5 today to 435. 62221 goes up 10 to 517. 62223 goes up 7 to 314. 62225 stays the same at 22. 62226 goes up 8 today to 585. 62232 goes up 4 to 141. 62239 stays the same at 74. 62240 stays the same at 24. 62243 goes up 3 to 54. And 62254 goes up 1 to 183. 62255 stays the same at 14, as does 62257 stay the same at 28. 62258 goes up 4 to 127. 62260 stays the same at 89. 62264 stays the same at 79. 62269 goes up 10 today to 422. And 62285 goes up 1 to 55. The regional positivity today, and that's a number that we need to get below 8 and certainly below 6.5 to start to roll back metrics, is at 9.8% today. So we're still way too high on regional positivity. And just for information, the state is reporting Bond County is at a 17.2% positivity rate today. Clinton County is at an 18.3% positivity today. Madison County is at 11.9% positivity. Monroe County is 35.5% positivity. Randolph is 29.9% positivity. St. Clair is 7.6% positivity. And Washington County is 10.3% in their positivity rate. So pretty high percentages there in the rest of the region. It's an issue here.
It's a big issue that we continue to work on, and we've got to really work hard this next week. I mean, we got a little reprieve yesterday on closing of the bars and the restaurants, only outdoor, but
and it made sense to stick with, the September 1st timeline is what we were given. And now it's a week ago. Yesterday it was 6 days ago, and basically we're just saying you gave us 2 weeks to move the to move those numbers down, and so let's see what we can do in those 2 weeks, just to see what the new restrictions actually do.
right.
That's what's important. Hopefully, in those outer counties and the rest of the region, they're abiding by those same restrictions and doing the same things that we're preaching here every day on this live feed.
Well, I know I got several calls today from some of the local mayors that was really appreciative, and they had already started notifying some of the businesses as quickly as possible that tomorrow was supposed to be that day. But then when we got the notification late yesterday afternoon, they had to go back, and we tried to get the word out to everybody. But all the mayors said the same thing. We don't want to go back come September 1st, so this next week is going to be really crucial to keep those get them numbers down as much as we can, and get everybody wearing the mask and staying focused on it.
And we appreciate the Department of Public Health and the governor's office engaging in a conversation about, hey, this is what we're thinking, what do you think? I think that's very healthy during a time like this to actually talk to the locals, who you're dealing with this every day. Sam is dealing with this, Barb Holt, Liz Patton at the Eastside Health District. This is really the only thing that, you got other things on your plate, as you were in Marissa a couple weeks ago, but this is really the main focus. And so for them to drill down on the local details to make that decision, because really, this is all local. I mean,
And they say that all the time. You know, yesterday on that call, they said, you know, they're watching the numbers that come in across the state, but they're watching each of these regions, and they can't be everywhere, so they're relying on the local health departments, the local EMAs, the local county officials, and I think that's why it's so important that, you know, we have done everything we could to keep our village leaders and the mayors and the chiefs and everybody updated, because we're all in this together. We could not do this without that team St. Clair attitude.
and there's a substantial compliance out there. I mean, people are wearing masks. The business owners are really trying. You know, the bars and the restaurants, they're wearing masks. They're doing all the right things. Now there are some that are cheating, and
Yes.
they're the ones that are hurting the numbers. So we had specifically liquor establishments that said, well, we're going to close at 11, but we're going to open at 12:01. You know, all those things that really, they certainly may, they may think that's smart, but it isn't
It's
smart.
not the best thing.
These rules were put in place because of trying to slow the spread of this virus, and to get out there and try to find loopholes and just to make a few bucks is really a sad thing. When we all can be together and we can get these numbers down and the economy can open up together. But if you have a few establishments that attract hundreds of people, well, these numbers, we're just not going to be able to get to the place we need to be.
Well, and it's the same thing we talked about. It's just not those establishments. It's these private gatherings that people are having, and we've got document cases through contact tracing where there's been backyard parties and things like that, and people just don't understand. Sam, I know you've heard about some of those. So it's definitely we just have to be conscious about this and understand. The sheriff, as you know, talked to us yesterday. He's had his patrols out there, and for the most part of it, the businesses are complying. Like you said, there's some of the bad apples out there that are trying to take the shortcuts, but they're going to be back out again this weekend because it's about compliance. I mean, he could very easily send undercover people into these places and find a lot more violations, but they're going in uniform and saying, "Hey, you're not conforming, so are compliant." So
It's not a gotcha thing.
no, it's not.
This is all about, come on, let's
Do what's right.
all do this and we can get through. We've only got, at least in my estimation, we've only got a few months left to get through this. That's what my hope is. That's what keeps us going, is that light at the end of the tunnel. So if we all hang together, we can all prosper and do better in this, as well as can be expected during this time.
And we want to talk a little bit about the mask giveaway. We got our first shipment of them in, so we're going to be having some more information about that. We're going to try to have masks available throughout the entire county.
We're going to distribute to every community.
Yes.
And we will eventually have about 500,000 masks.
Yes.
We've got the first group in of 250,000 masks, so the communities will be able to come pick up, and these will be masks for them to distribute to the public.
Yes.
And when we talk about backyard gatherings, there's nothing wrong with getting together, but you really should use those same restrictions that are out there in the
Physical distancing and the mask and
wear a
personal
mask
hygiene.
and keep your group small, and you're with your friends anyway. The last thing you want to do is get your friends sick or your family sick, and certainly the people that they then carry it to.
So, well, you'll be hearing a lot more about that over the next couple of days. As the chairman said, we're getting the community leaders notified, and they'll be picking up those first shipment of masks, and then they'll be coordinating that throughout their communities and through the townships. Tomorrow we've got 49 of our first responding agencies coming in to pick up PPE that they've requested, so we're helping them. And as I say all the time, that regional positivity rate is what I go to bed thinking about and wake up thinking about it, because that's what we have to get down. And I just can't say enough for all of you who are supporting Team St. Clair and spreading the word. I see those messages every day, and the shares that you're doing. Believe me, if you may not think it's had an impact, but it has, because we get calls here at the EOC every day. Somebody saying, "Hey, we didn't know that St. Clair County had this. Any of the other counties have this type of service?" And none that I know of, but we do this regionally. We've had people call us from Madison County, from Monroe County, Washington County that follow us on here because we're all in this together. You know, if one part of this region isn't doing good, and as we look at these positivity rates, there are some that are out of whack here. And
Herb, we were the highest
well, yes,
in the region for a long time, and today we're not. Today we're actually the lowest in the region, but really we're all in this together, and so where one is high, I mean, we're all high. So we might as well all hunker down together and get through this and get that regional number down.
Yep, and then we can do that. As I said, together we can do this and get back to some normal sense of life that we all are waiting for. We've all want this behind us, and I think as the chairman and Sam has talked about many days now, just those 3 W's is the most important. The mask is just the most important because you know you're protecting yourself, protecting others, and as I tell you all the time, it's not a cure, but it's a precaution, and that's what we're talking about. Look out for your fellow man and your family, your parents, your grandparents, your kids, and we'll get through this. So, and that's being a part of the solution and not part of the problem. So we'll be back with Cindy and Daisy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow afternoon with the next briefing and some more information. Have a good evening.